Assalamualaikum and hi everyone. In today's video, I would like to share about megaloblastic anemia. Do you guys know what megaloblastic anemia is? Megaloblastic anemia is a type of nutritional anemia due to the deficiency of vitamin B12 and folate. As a result, the bone marrow produces unusually large, structurally abnormal, and immature red blood cells called megaloblasts. These megaloblasts occur due to the asynchronous maturation between the nucleus and the cytoplasm of the hematopoietic cells. As for megaloblastic anemia, the most common causes are deficiency of either cobalamin vitamin B12 or folate vitamin B9. These two vitamins serve as building blocks and are essential for the production of healthy cells such as the precursor of the red blood cells. Without these two essential vitamins, the creation of DNA cannot happen. The reason why this two vitamin deficiency can occur includes inadequate intake of cobalamin and folate in the diet, poor absorption of these vitamins by the intestine, or improper utilization of this vitamin by the body. Other than that, do you ever know that folate deficiency may also result from the condition which use up or require excessive amount of folate? In a rare event, megaloblastic anemia could be due to inherited problems such as thiamine-responsive megaloblastic anemia syndrome, inherited deficiency of intrinsic factor, or the receptor in the intestine, or congenital folate malabsorption.
Huh? How vitamin B12 and folate deficiency can cause megaloblastic anemia? I don't understand.
Okay, don't worry. Let me explain it to you. Physiologically, we need to know that these two vitamins are essential for the synergetic role in the synthesis of DNA, whereby at the molecular level, they are needed to convert homocysteine to methionine and also for the synthesis of thymidine triphosphate in the DNA synthesis pathway. As a result, DNA synthesis is interrupted and lead to the death of hematopoietic cell precursor and eventually causes ineffective erythropoiesis. This condition is the reason why anemia can occur. Not only that, the destruction of DNA secondary to the vitamin B12 and folate deficiency will contribute to the asynchronous maturation of the cytoplasm and nucleus of the erythrocyte precursor, in which cytoplasm matures at the normal rate, but unfortunately the nucleus is not fully matured. What happens next is, the cytoplasm of the cell will appear larger than the nucleus itself, which is called as megaloblast. So that is how megaloblastic anemia can occur. To diagnose this type of anemia, there are several ways. In CBC, the finding is macrocytosis, like this. Furthermore, varying degrees of leukoneutropenia and thrombocytopenia can be present, especially in the case of chronic deficiency. Secondly is low reticulocyte count. Next, in peripheral blood smear, we can see megaloblasts that are highly suggestive of megaloblastic anemia. Also, hypersegmented neutrophil with 6 or more loops present on the smear. Other findings include holy jolly bodies, anisocytosis, and poikilocytosis. Worry not, megaloblastic anemia can be treated using several types of therapies, which are intramuscular injection of hydroxycobalamin. Usually, patients will receive 1000 micrograms of vitamin B12 daily in their first week of the treatment. In the following month, they receive weekly and then monthly injection. In the case of folate deficiency, folic acid supplement 1 to 5 mg per day is usually given orally. In patients with malabsorption, parenteral preparation is the recommendation. To prevent relapse, treatment should continue for a minimum of 2 years. In the case of severe megaloblastic anemia, both vitamins may be given initially and continued until the cause of anemia has been established. In a nutshell, from the Islamic perspective, Islam requires us to take a good care of our health so that it will stay healthy. Our body is entrusted from Allah, thus we need to protect it from any threat of disease. Plus, Islam is very concerned on the aspect of health because a better health can bring us closer to Allah in a better way by giving us enough energy and time to worship Allah. There is a hadith that said, there is no disease that Allah created except that he also created its treatment from Sahih al-Bukhari. Thus, as a Muslim, we need to stay healthy and seek medicine to cure a disease, as the need to seek treatments turns to mandatory when Muslims are not able to bear the pain or if the disease is a life-threatening. I think that's all from us. Thank you.